If you're looking to get a drug approved in Saudi Arabia, listen up because the game has changed. The SFDA has a brand new rulebook for submissions that rely on existing research. It's called a literature-based submission, or LBS. And if you don't get it right, you could be facing some serious delays. So today, we're going to walk through the exact blueprint you need to nail this process.
All right, here's our plan. We'll kick things off with the big deadline that's making this so urgent. Then we'll get into the fundamentals of what an LBS actually is before we map out the entire submission process. From there, we'll do a deep dive into the most critical part, the literature review, see how that translates into your final dossier, and then wrap it all up with the key takeaways you absolutely need to know.
So why all the urgency? It's simple. This isn't some far-off proposal. It's a hard deadline. On July 12th, 2025, these new rules go into full effect. The clock is officially ticking, and any submission after that date has to follow this new blueprint. So, understanding it now isn't just a good idea, it's absolutely essential.
So what's the SFDA really trying to do here? Well, the main goal is to standardize everything and, frankly, raise the bar on the quality of clinical data when it's coming from existing literature. For you, this means more predictability, but it also means a higher standard of evidence. Now, this guidance specifically applies to two main types of applications, generic products and what are called known active substance, or KAS, applications. And we'll dig into what those are in just a minute.
Okay, so what in the world is a literature-based submission? The best way to think about it is like you're a scientific detective. Instead of running brand new clinical trials from the ground up, you're building a rock-solid case for your product's safety and efficacy by systematically gathering, evaluating, and putting together all the high-quality research that's already out there.
And that leads us to the really crucial strategic question: when is this the right way to go? You don't use an LBS for every single submission. The SFDA has laid out some very specific situations where this approach isn't just an option, it's actually what they expect you to do.
And here they are, the two key scenarios. The first one is for a new generic product, where the original big-name innovator drug isn't actually registered with the SFDA. The second scenario is for a known active substance. That basically means you're proposing something new, like a new use or a different dosage form for an active ingredient that's already available in Saudi Arabia. So, how do you actually pull this off? Well, the journey to getting that approval is really a three-step roadmap. It all kicks off with a super important pre-submission meeting. Then you move into preparing the detailed submission file, the ECTD dossier. And the final step is managing that back and forth with the agency, making sure you concisely address any questions the SFDA throws your way. Let's just pause on this one for a second because this is huge. The pre-submission meeting is not just a box to tick, it might be the single most important part of this entire process. Why? Because getting on the same page with the SFDA here about 3 months before you even file can save you months or heck, even years of rework and questions later on. It's your ultimate risk reduction step. Don't skip it. Now, this is where things get really specific, especially for generics. The key difference here is whether your reference product is registered by a major global regulator, what they call an SRA. If it is, a standard literature review is generally enough. But if it's not, the SFDA raises the bar way higher. They're going to demand a full-blown systematic literature review and much broader post-marketing safety data. The burden of proof is just so much higher without that SRA stamp of approval. Everything we've talked about so far really funnels down to this one single point: the absolute heart of your submission. The foundation that your entire application will either stand on or crumble is a robust, transparent, and scientifically defensible literature search strategy. This is where applications live or die. So a great search always starts with a great question, and the SFDA guidance points you directly to the PICO framework. Before you even think about opening a database, you have to clearly define your population, the specific intervention you're studying, the comparison or control group, and the outcomes you're measuring. This gives you the focus and clarity your entire review will depend on. Okay, with your PICO question locked and loaded, you're ready to actually execute the search. This means using powerful databases like PubMed, leveraging medical subject headings or mesh terms, and using Boolean operators to really zero in on what you need. But, and this is the most important part, you have to document every single step. Seriously, if the SFDA can't perfectly reproduce your search from your records, then as far as they're concerned, it's like the search never even happened. Once you've found all your studies, the next step is absolutely critical. You can't just throw them all in a pile and treat them as equal.
you have to formally assess the quality of the evidence. The SFDA needs to know how much confidence they can actually have in the results of each study you decide to include.
And the recommended way to do this is with the grade methodology. It's actually a pretty cool dynamic scoring system. See, a randomized trial starts off with a high-quality rating, but you can downgrade it for things like a high risk of bias, or if the results are all over the place. On the flip side, an observational study starts low, but you can raise its quality rating if, for example, it shows a massive effect or a really clear dose-response relationship.
And finally, you get to extract and analyze the data from all those high-quality studies you've selected. The guidance points to the Cochrane Handbook as the gold standard here. You'll be using tools to check for bias, systematically pulling out all the key data points, and then synthesizing it all, either statistically through what's called a meta-analysis, or if that's not possible, through a really detailed systematic summary.
Okay, theory is great, but let's make this real. What does this process actually look like for a specific submission? Let's walk through our first case study, submitting an application for a generic product.
For a generic, the journey's pretty straightforward. First, you confirm the innovator product is not registered by the SFDA. That's what triggers the LBS pathway in the first place. Then you build a PICO question focused on demonstrating equivalent efficacy and safety. After that, you execute that documented, systematic search we've been talking about, and finally, you synthesize all that evidence into the clinical overview in Module 2.5 of your dossier.
Now let's look at a more complex scenario. What if you have an active substance that's already approved, but you want to get it approved for a totally new therapeutic use, based only on published literature? This is our known active substance, or KAS, case study.
For this one, that pre-submission meeting becomes even more vital. You absolutely need the SFDA's buy-in on the LBS approach right from the get-go. From there, you'll define a super-specific PICO for that new indication, you'll conduct your systematic review with rigorous grading of the evidence, and then you'll compile all that data into the specific summary reports and tabular listings that the SFDA requires. So let's just boil all this down to a simple cheat sheet, right? The winning moves are pretty clear. Book that pre-submission meeting, document absolutely everything, and stick to proven frameworks like PICO and GRADE. And where do people mess up? Well, it's usually the simple things: sloppy documentation, weak excuses for why they excluded certain studies, or giving vague answers when the SFDA asks for more detail.
It's also probably good to know that the SFDA isn't just making these rules up in a vacuum. This new guidance actually aligns pretty closely with the approaches used by other major regulators around the world, like the TGA in Australia and Health Canada. So this kind of harmonization is really a positive sign for global pharma companies.
All right, let's wrap this up. If you're walking away from this with just a few key points, these are the ones to remember. 1, that 2025 deadline is real and it's firm. 2, the pre-submission meeting is your most important strategic tool. Use it. 3, your search has to be systematic and perfectly documented. And 4, PICO and GRADE aren't just suggestions, they're your core frameworks for success.
And at the end of the day, why does all this matter? Well, the SFDA says it best themselves right in their own guidance document. Following these rules isn't just about checking off boxes on a list. It's about avoiding unnecessary delays and helping the agency make faster, better decisions. Ultimately, it's about getting safe and effective medicines to patients more efficiently. So I'll just leave you with this final thought. A literature-based submission isn't just a collection of papers you've found. It's a structured, scientific argument that you are making to a regulator. And the question you really have to ask yourself is the evidence you've gathered, graded, and synthesized strong enough to actually win the case for your product?